We're back now at 11:49, and COVID vaccines are now approved for everyone aged 6 months and over. I'm joined now by Dr. Jeff Potthoff from UW Health. Good to see you, Dr. Potthoff. Always good to have you here.
Good to see you too.
So we're talking about the approval from the CDC now on these kid vaccines for children as young as 6 months. What is the most important thing that parents should know about this morning?
I think the most important thing for parents to know about it this morning is they can now protect their youngest children from COVID-19. And although it's true that children don't have severe disease at the same rate, i.e. hospitalizations or deaths, it's fair to say that some children do die from COVID-19. And even if that rate is small, doing whatever you can to protect your child is a good thing. Not to mention, they may not have as many long-term effects from COVID-19 if they're vaccinated. They might be able to enjoy their summer without being sick for a week and a half with COVID-19.
And so how can families go ahead and start vaccinating their children? Is this something that can start right away?
It's something that can start right away. The CDC endorsed this on Saturday. Now, this dose is a little bit different than what a lot of the pharmacies will have in stock, although a lot of those doses are getting to pharmacies, health systems. I think, as early as tomorrow, you may have some vaccinators who are able to do this. Certainly, if you give it a week or so, I think most will have this. Really just call around to pharmacies in your local area, talk to your health system. Good chance the next week or so you could get your very young child vaccinated.
And we look at the numbers every morning, the numbers of people who have been vaccinated, the people who the case numbers as well. We've seen the numbers for children not vaccinated. They haven't really gone up anywhere. Is this going to maybe move that?
Maybe. I think there's still this perception from a lot of parents that it's not as important to vaccinate their kids. And I think there is kind of this hesitancy to get them vaccinated because they know with that second dose that their child's likely to feel kind of punky the next day. But really, it is important to get our kids vaccinated. It prevents severe illness. It can stop illness from happening at all. And it's just a good idea to prioritize this, make that phone call, get an appointment, and get it done. And I'd love to see those vaccination rates for young kids increase.
And really quickly, before we let you go, I want to talk about traveling. People heading to different destinations this summer. There are new rules now, the rules that are now relaxed in terms of testing when it comes to travel.
Yeah, I think we're seeing this decision as another indicator that the COVID-19 pandemic is entering an endemic phase. The reason this decision could be made is that even though we are seeing pretty high numbers of cases, what we're not seeing for the first time is a reciprocal increase in hospitalizations, in deaths. So it's not to say that if you travel that you're not going to come in contact with someone who's got COVID, but either through natural immunity or vaccine-induced immunity, we're not seeing as much severe disease as we saw before.
Well, that is a good thing. That's a great note to end it on. Dr. Jeff Potthoff from UW Health. Always good to have your insight. Thank you.